disproportionately impacted with HIV, I want to say to you that real freedom comes with discipline. And what I mean by that, and this isn't just for young people, this is for all of us. But I do hear about our young people who just don't get the history. And I was reading a book and it intrigued me where this young person was watching somebody play the piano. And the young person said, I wish that I could play the piano so freely. And what they didn't understand is the freedom expressed in the person who was playing the piano came from great discipline. And so getting to zero means that we're all going to have to step up. And the freedom that we want is going to come with acknowledging the cost that has been paid before, and also with responsibility and ownership. We will not get to zero if there is no ownership. But we have to work with our youth and work with young men that you're working with to support them, make it safe, make them not feel horrible about making some of the same mistakes that we made, and create the safe places and mentor them and help them. And I believe that actually one of my biases is that prep may give us the opportunity. I am not a supporter for lifelong prep. I am a supporter in a program that would give me an audience with a young man before he meets me with HIV, where I can deal with sexually transmitted infection, where I can vaccinate him against hepatitis A and B, where I can talk about safe sex, where I can deal with mental health issues with him, where I can deal with housing, and then give him the support that he needs so that he can hopefully make better decisions. And I think we have to look at all the options that we are afforded us if we're going to get to zero. I did a fancy presentation about 4 or 5 years ago, and I was talking to about 70 healthcare professionals. And at the end of the talk, similar to the end of this talk, I put a slide up that said, "Are you HIV positive?" Let me help you with the setting. It was a beautiful hotel, open windows, looking over Norfolk and looking over the bay. There were fresh flowers on every table, too many forks. Very fancy. So I put up this slide, and I had been talking about p-values and things that are statistically significant. And I said, and I put up the slide, I didn't say anything, "Are you HIV positive?" People who weren't thirsty started drinking water. People whose mouth was clean started picking up napkins and cleaning their mouth. People who had dropped things started looking down into the floor. And I said to them, I'm not asking you about a blood test. I really want to talk to you about a perspective. I want to talk to you about an attitude. Are you HIV positive? I tell my clients, don't hang around anybody who's HIV negative. We're talking about living well with HIV. We're talking about having a good attitude, being hopeful, and positioning yourself to live well, and surrounding yourself with the support that you need to live well with HIV. Living well with HIV requires the engagement of the entire community, friends, families, clinics that are focused on excellent HIV care and delivery, clinics that are real good at outreach and testing, or married to somebody who does, clinics who are real good at linkage to care, clinics who are real good at treatment, and not just treatment, but early treatment, clinics who are really good at not just telling you how many people that come to their clinic, but clinics who are focusing on adherence and retention and actually keeping people in care so that we can move from 25% of our people being virally suppressed to 90% of people who are living with HIV being virally suppressed. Living well with HIV requires a full engagement of the entire community. I'm talking about the faith-based community, I'm talking about arts and entertainment, I'm talking about civic, social, and I'm talking about education. So today we educate and we remember. We also celebrate. We educate and we sound the alarm that HIV is still an issue in our cities. We focus on prevention, we focus on testing, we focus on linkage to care, we focus on treatment, and also on retention. We purposely pause to remember people who have been lost related to this virus. And we remember relationships. And I even while I say that, I just want to slow down because I just see faces of people that I've cared for, who are fantastic people who are gone. And if we're not careful, we're so busy that we forget. But today we stop and we remember. Today we celebrate purpose, a sense of direction for our lives to fellow HIV providers, whether professional or volunteer. I hope you have a renewed sense of dedication for the work that we love and we feel so privileged to do. And for those of you who are living with HIV, I hope you have a renewed sense of purpose, impact, and feel a sense of responsibility to make a difference. I've been sharing something for a couple years with my clients, and I want to share this with you guys today. I often run out of my office. It's so hard for me to stand still. You guys have no idea what a challenge this was. But I am so often in my office meeting lions. I meet some incredible people. I meet women who raise their kids alone, who their children were the first in their family to go to college, who worked 2 jobs. And I'm thinking about a woman who was diagnosed with HIV. She was, her husband, she was a widow. She started doing Bible study with a gentleman in her church, and they ended up being intimate, felt bad about it related to their faith. And he called her from the hospital with pneumonia and told her that he had HIV. And she came into my clinic ashamed, but I saw a lion. And so when she opened her mouth, I expect to hear a roar. But I heard a meow. And I was so confused and troubled that we allow HIV to steal who we are, as if that's all that someone is. You know, there's this urban phenomenon, and I don't know if you guys do it here. You seem kind of upscale here. I mean, really, you're in a museum. Clients in Baltimore say, oh, she HIV, oh, he HIV. And do we say, oh, he diabetes? Somebody's got to rise up and say, there's more to me than HIV.
Amen.
And I'm not sure what you've been through, but can I mess with you that whatever God's brought you through, He's called you to? Some of you have stories. It should be on TV. You ever look at the Olympics and you hear the story of these Olympians and you go, oh my gosh, they've been through so much. What heroes are they? I work with a bunch of heroes. I'm appreciative of Magic Johnson. I work with a lot of Magic Johnsons. I work with some people who have overcome against all odds some incredible things. And I want to help them to move from meowing to move into roaring. Because they're a lion. What matters most is how you see yourself. And if somehow what we've been through begins to identify us, I dare you to begin to look on the inside and not measure yourself based on what you've been through. People may laugh at first when the little kitten acts like a lion, I'm gonna leave the mic for a minute. Are you guys recording this? So the little kitten that thinks he's a lion, the little kitten, y'all, walks in the room like this.
That's right.
Sweat. Little kitten got sweat.
That's right.
You will laugh at the little kitten for a minute. But as the little kitten walks in his robe and don't drop it, you're like, okay, you're serious.
Right.
And who was laughing will stop laughing as you walk out your inner you. To my healthcare professionals, for us to get to zero, we are going to have to be courageous. Just like our clients have to be courageous, we are going to have to be courageous. There is a man in me. Your brother is bad. Some of y'all hate me, I feel it. I'm just saying, there's a brother in me, the brother is bad. He is an incredible father, off the chain husband. This brother has local impact. You really about to hit at another level. This brother has national impact. The brother in me, right there, the lion, he has global impact.
Okay.
And I'm trying to say to you leaders, because if I ever get a chance to teach, I'm teaching teachers. If I get a chance to lead, I'm leading leaders. The woman in you and the sister is off the chain.
All right.
There's a man in you, and he is the true definition of leadership. He is influential. Things happen because of who he is. And for us to get to zero, we're going to have to not be intimidated based on what we've been through, but we're going to have to rise up and be the image. You know, every day I'm trying to be that man. I make decisions based on what he would do. Sometimes I shut up and don't talk because I'm like, he would say that. So that's not how he would act in this situation. I'm trying to be big. And we are at a point where we need persons living with HIV, researchers, government to be big. Because we have a lofty goal. We are trying to get to zero. We're trying to get to zero discrimination, to zero death, and to zero infections. I want to say to you, because I'm 15 seconds done, you are not called to do everything, but you are called to do something.
Right.
What is your something? Do it, because nobody can do it better than you.